So these are the growth factor concentrate kits. So we have a withdrawn patient blood, and right now after withdrawing 4 ml in the H tube, we need to insert up and down for 8 to 10 times so that the activator gets mixed well with the blood, and we need to keep it in a standalone position for the next 20 minutes where the platelets will get activated. Then the process will be the centrifugal process, where we need to spin for 10 minutes at a centrifugal speed of 3400 to 4000 rpm. Please stay with us so that we can show you the centrifugation. So, as we have discussed that after just inverting this 5 to 10 times, we need to keep it in a standalone position right now. So we have just crossed 20 minutes. Right now we need to centrifuge at a speed of 3400 to 4000 rpm for the next 10 minutes. We need to place in the centrifuge machine. Make sure. So we have balanced the centrifugal machine. So we need to set the time. The time will be for 10 minutes and the speed is 3400 rpm.
Hi, so now I am starting the process of growth factor concentrate therapy for our patient Prakha, who is doing this session for the 4th time at New Follicle Transplant Clinic, to see some obvious difference in the male pattern hair loss, hair thinning, to regrow the dormant follicles, to strengthen them, to increase the density. So first and foremost, I will go with the derma roller process on his mid partition scalp area with a needle size of roughly 0.5 to 1 mm depth, to improve the microcirculation of the blood. So we are using this vibrating device to ensure that the patient doesn't have much pain during the entire process. Prior to the process, we had applied local anesthetic cream, that is Toplap or Prilox, onto the scalp to minimize the sense of any kind of pain and to reduce and to numb that area. So the entire scalp will be first treated with this derma roller process, which we do in a star crisscross pattern to ensure better growth of fine hairs. Then we have used this kind of GFC tubes to extract the autologous growth factors from Prakhar's blood. So what essentially we did, we drew some 20 ml of blood from his intravenous line and we kept it in this kind of tubes to first precipitate or activate the platelets. After that, we did the centrifugation of this serum so that all the cells were separated, including RBC and WBC and even the platelets. So directly what we are getting in this is the gold fluid, we call it, or the GFC session, the growth factor concentrate or autologous growth factors. So this process is an office procedure. It's a very safe procedure that doesn't leave behind any kind of foreign body reactions, because it is the patient's own blood, and the growth factor concentrate, which is extracted from the patient's own human blood, has lot of growth factors and not inhibitory factors. What are these growth factors? These growth factors are VEGF, PDGF, epidermal growth factor, transforming growth factor alpha, like this. So these are chemical mediators or interleukins which stimulates the stem cells, improves the hair follicle maturation and even improves the proliferation of the stem cells. Post-procedure instructions are also very few, that the patient should not take head wash for next 4-5 hours post-procedure. The patient should not drink or smoke. The patient should not go for heavy strenuous exercises or swimming or gymming, or no cardio, nothing, for at least a day. Patient's metabolism should be limited, should not be exposed too much to sun, pollution, dust. We'll give him a surgical cap post procedure to avoid any kind of scalp infections. Anyways, the patient's scalp is very healthy. There's no signs of any dandruff or dermatitis. So I think we are done with the procedure for GFC for today. Hope to tell you something more about the process once he visits us for the next time. So